right, welcome everyone. I'm going to be giving a presentation about a new aggression measure, hopefully that we can start using. So here's our disclaimer. And I'm a child and adolescent psychiatry fellow. I see a lot of different kids for various things. One big thing that comes up is aggression. So one day in clinic, Alex walks into your office and starts ripping up paper and throwing tiny pieces all over the floor. Kind of try and intervene, parents try and intervene, you try and redirect maybe to the tiles, start trying to do some more play. Then he shoves all the toys off the table, throws a potted plant at you or attempts to, and then kicks parent in the shin and runs out the door. So what's the diagnosis here? Do we treat this? Do we intervene? Medications, therapy, kind of this tantrums not otherwise specified at the moment. So something that's been a big challenge in the psychiatric field is kids presenting for aggressive behaviors. It's something that is fairly common and still remains poorly understood. And it doesn't always fit neatly into current diagnostic categories and can present in quite an array of mental health diagnoses. And one of the ways we've sort of formulated aggression is to two main types of proactive or reactive. So the proactive is kind of considered like planned, bold, maybe a little bit more like criminal intent sometimes coming into play versus the reactive, impulsive, hot, intentionally planned kind of comes out of nowhere. And this delineation is important because youth with impulsive aggression can benefit more from behavioral interventions and pharmacotherapy. And so one reason I think this is important is we don't necessarily have validated tools that are free and accessible to clinicians to assess aggressive behaviors in clinics. So this new questionnaire, the RAGA-16, Reactive Aggression Assessment, is something that I came across and was shared with me and I think could be potentially quite valuable. There are limitations from prior measures, costs, then they're either too long or they don't fully capture the behaviors. Like they only look at 1 week versus like this whole bigger experience of kids having challenging behaviors throughout the course of the year. So this is free, it's novel, it's been validated and came out of actually a pediatric bipolar registry and a much more thorough assessment. They pulled out the questions that were more relevant to aggressive behaviors. It has undergone some validation and is currently undergoing more validation. And does capture multiple elements of aggressive behaviors. And the goal here is to be transdiagnostic. So this can be a tool we could use in an array of different diagnoses: autism, ADHD, bipolar, depression, anxiety, all of them. So here is the assessment, and you can see a few of the symptoms. Like, does the kid get mad easily? Do they yell when they're angry? Do they start to threaten other kids or adults? Do they start to break things? Do they hurt other people? How often is this happening? How severe is it? And in what settings? Like, these are all very important elements to understand what's happening with these aggressive behaviors and kind of help us understand what's maybe the threshold to intervene. What child would benefit from behavioral interventions versus pharmacotherapy? So the current validity studies have been done with about 430 youth, 3 to 17. Most common diagnoses are ADHD, anxiety, depression, also a history of abuse and neglect. It was looked at both outpatient settings and in the emergency department. Outpatient, they found more looking at ADHD or ASD. The emergency departments were largely with depression, abuse, neglect, acute stress. It has high reliability and behaves similarly to other aggression scales and does perform better in outpatient settings. The more kind of validity information, and here's just kind of showing that it has a nice comparable validity to the ARMOAs, which is a modified overt aggression scale. It has better validity in outpatient settings compared to inpatient settings. So why am I doing this? It was already validated at a single site. We know it works there, but do we know it works in other places around the country? And so part of my work this year has been to set up a field trial and create UC Davis as one of the sites for this field trial. So the hypotheses were this assessment, the reactive aggression assessment, RAGA-16, will be significantly correlated with existing validated measures of aggressive behavior. And then we expect earlier age of onset, higher frequency of severe temper outbursts will distinguish children from impulsive aggression warranting treatment versus children with non-specific aggressive behavior. Like, are they having one outburst a year, or are they having daily multiple outbursts a year that have safety concerns that maybe do warrant intervention? And then we also hypothesize UC Davis will be similar to other sites. So inclusion criteria, we're looking at kids 4 to 12, aggressive behavior is a main concern. This study unfortunately does have some exclusionary criteria for IQ less than 70, diagnosis of autism, substance use disorder, and then unstable medical illness or inability to converse in English. And then with this information, we're going to do some more deep phenotyping. So really trying to understand maybe what's contributing to these aggressive symptoms, looking at aggressive behavior, ADHD, trauma exposures, depression, mania symptoms, family history, functioning, medications, service use, a lot of different elements here. So research sometimes takes quite a bit of time to get going, and unfortunately the study just got approved this past month, so I don't have data to present today, but I'm very hopeful we can get some and would love for you to refer patients over. Future directions, we have submitted a grant to further validate this in autism spectrum disorders, because I do think this could be quite valuable to better assess and understand aggression in autism. And then we've also submitted another grant for funding in autism and ADHD. And why am I trying to validate another tool here, essentially for aggression? I think it's really important for finding more interventions for aggression in the outpatient setting, whether it's autism or other diagnoses. We do need more treatments, more interventions, and more tools to show that benefit in clinical outcomes. Please, if you have any patients who you think might be a good candidate for the study, please refer them our way. They could also get some further diagnostic interview to help with maybe clinical diagnoses if you're unsure. And I wanted to thank Dr. Singh, Dr. Gupta, Dr. Hagerman, my family, other LEND faculty and trainees for your support, wisdom, education, and inspiration.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.